Hello and thanks for watching. The purpose of this presentation is to provide San Joaquin County residents with information regarding syphilis, including signs, symptoms, prevention, testing, and treatment. The number of syphilis infections in San Joaquin County has greatly increased in recent years. San Joaquin County currently ranks second in California for syphilis infections and 30th out of all counties in the United States.
Syphilis is a bacterial infection caused by a corkscrew-like bacteria. It's usually spread via sexual contact, which makes it a sexually transmitted disease, but it can also be spread from pregnant mothers to their babies. Early syphilis can be cured with antibiotics. However, without early treatment, it can spread to the heart and brain, which can be life-threatening. It is a very serious STD, and it is very prevalent in the San Joaquin Valley. So this presentation is designed to inform the community about it and encourage safe sex practices to stop the spread of this dangerous infection. Congenital syphilis occurs when a pregnant woman who is infected with syphilis passes the infection onto the unborn baby via the placenta. Some newborns may have no symptoms initially, while others may present with a rash. And later on, you can actually have serious complications, such as facial deformities and/or deafness. There is also a risk for babies to be born too early and can actually be stillborn too. So it's very important to screen pregnant mothers for syphilis, and prenatal care is very important for early detection and treatment.
Risk factors and prevention. Risk factors for contracting syphilis would be having unprotected sexual activity involving the oral, genital, or anal mucosa. Having sex with someone from a country or region with a high prevalence of syphilis, or concerning congenital syphilis born to a person diagnosed with infectious syphilis in pregnancy. Prevention would be abstinence from just not have sex, monogamy, being with just one person, or practicing safe sex, like, for example, using condoms.
Hi everyone, my name is Bailey. I'm going to be talking about the signs and symptoms of syphilis. Syphilis is grouped up into 3 different stages, but before we talk about these 3 different stages, I just want to point out something that is important to know, which is once it's contracted, it may not have an outward appearance on the body until about 2 to 3 weeks later. And then it develops into what they call primary stage, which is the first stage. During it, the patient or someone that's contracted syphilis will have one or multiple sores around the site of origin. The sores can be firm, they can be round, and typically they're painless. And this stage usually lasts anywhere from 3 to 6 weeks, and they'll disappear with or without treatment. Now, if they don't get treatment in this first stage, they'll go into a secondary stage of syphilis. And this usually involves a systemic rash. And the rash will appear typically on the palms of the hands, soles of the feet, or it can be on the back. The rash is typically painless and doesn't itch. And the color of it is usually reddish, brownish in appearance. And also they'll develop a fever, sore throat, swollen lymph nodes, and severe fatigue may be present at this stage as well. If syphilis is not treated at this time, it can continue on to the last stage, which is known as the latent, and then there's also a tertiary stage. So if it's not treated at the secondary stage, then a latent stage develops, and this is where there's no visible signs or symptoms of syphilis in the body. This stage can actually last from anywhere from the ending of secondary stage up to 30 years. So it can lay dormant in the body for quite some time. And then if it's still not treated properly, it develops into a tertiary stage. And this is where the infection can lead to internal damage and result in various health problems such as compromised organs and even result in death. Typically, it's the most dangerous stage because it affects the heart, the brain, the nervous system, and various blood vessels. So it's important to get treatment right away once you contract an STD. Thank you.
So now that you know what syphilis is and the signs and symptoms to be aware of, let's talk about the treatment of syphilis. So it can be a scary diagnosis, but it is actually easily cured, especially if it is caught in the early stages. So benzathine penicillin G is the treatment of choice for syphilis. It is a long-acting single intramuscular injection to cure those with primary, secondary, or early latent syphilis. It is an antibiotic. It is used to destroy the organism that causes syphilis. If you are pregnant, penicillin is the only recommended medication to treat syphilis. For those with latent syphilis and syphilis of an unknown duration, must receive 3 doses of benzathine penicillin G. So basically, they will be receiving 1 dose a week. Those with neurosyphilis will require a short hospital stay to receive daily doses of penicillin intravenously. For those allergic to penicillin, there are other options for treatment. So this can include doxycycline, tetracycline, azithromycin, and ceftriaxone. Those who are receiving treatment for syphilis must refrain from any sexual contact until the sores are healed, and it is also courteous of them to notify their sex partners so that their sex partners can get tested and treated if need be. Now, once the treatment is complete, follow-up care will include visiting a healthcare provider to receive blood tests to confirm the syphilis has been cured.
A simple blood test is all that is needed to diagnose syphilis. Within San Joaquin County, there are numerous places to get tested and treated for syphilis and other sexually transmitted diseases. If you do not already have a primary healthcare provider, several locations provide services free of charge or low cost. Testing and treatment is always confidential. Community Medical Centers has over 21 clinics in San Joaquin County. In addition, community medical centers can provide assistance with enrollment in Medi-Cal or covered California health insurance. Stockton Health Center also provides testing. Call the numbers or visit the websites listed above for more information and to make an appointment. It's very important not to delay testing for syphilis. Early treatment prevents serious complications.